Good afternoon. My name's Hayden. I work, of course, for Mighty. No more clues on the branding. First of all, thank you. Thank you for actually getting here on the second time of asking, given the Queen's funeral arrangements and bank holidays. And then secondly, thank you for attending this session as opposed to the other one. So ever so grateful. I don't know whether we've got half the audience here today compared to the other room, but we shall start as we mean to go on. So I work for Mighty Communities, which is part of Mighty's UK facilities management business. So I'm assuming most of you know who Mighty are, and some of you may or may not be working with Mighty. So if you don't, then clearly come and see us afterwards for more of an in-depth explanation as to who Mighty are. But we are the UK's leading facilities management organisation. I know there's some competitors in the room, so I just said that to wind them up. So today we will, if I can get my machine here working, we will run through an explanation of what social value is. We will work through an example of some of our social value initiatives, particularly in net zero. We'll look at what our organisation called Mighty Foundation does in the social aspects of social value. And then George, and I'll introduce George and Gareth in a minute, George will look through UCLH as a case study and some of the initiatives that we've been developing in UCLH. Sorry, I'm going to do this because this is where technology works at the point at which it works, doesn't it? Back on again. So, George is our UCLH Strategic Account Manager, so he'll get the microphone in a short while. Gareth, before that, is our Client Development Manager working within Mighty Energy. So we'll start to answer how can we deliver social value in the healthcare sector. And as I say, we'll describe and define what social value is to start with. We'll then look through some case study examples. We all deliver social value. And I think this is part and parcel of the challenge of explaining some of this. In the healthcare sector, we're in the healthcare sector to deliver patient care, amongst other things, and particularly in Mighty Communities, working across local government as well as the education sector, social value is core to what we do. We did a few straw polls before coming here about what's important around social value. Is it the three aspects of social value: social, economic and environmental? And I'll put up some statistics shortly in respect of the feedback that you offered us. But those are the fundamental themes of social value, three aspects to it. And how is social value linked to FM? Well, you guys run estates with support from organisations like Mighty. It is part and parcel of what we do as a service provider. It's integral to what we do, and clearly certain laws in the United Kingdom describe how we measure it and how, in linkage to something called PPN 0620, how we start to performance manage all that we deliver in social value. It's clearly good business practice. Lots of people have been delivering social value for a long time, Mighty included. And of course, it's now part of bidding and winning and delivering work. And there's a measurement, of course, as part of that. As I said, we asked a few questions of you and others on LinkedIn before we came. And just to try and dip test to some extent what's important to you guys in respect of social value. And interestingly, 50% of people, no surprises I guess, are now saying it's the economy, it's the economic parts of social value that are really important. If we'd have been stood here perhaps pre-COVID, those of you that cast your mind back to the 2019 general election and a bit of a Dutch auction around different political parties describing how they're going to get to net zero, the earliest, 2 or so years ago, it would have been perhaps net zero as being the main target around social value. Health, jobs, employment, clearly health through COVID, I suspect that statistic might have been a little bit more if again I'd asked this 12 to 18 months ago. At this point in time, levelling up the economic crisis is clearly in people's minds. So that's something that we, I think as organisations, need to take cognizance of in developing social value initiatives now and in the future. We then asked the question about net zero. Where are you on net zero? And I think it's fair to say that a number of people pre the pandemic had a plan on net zero. They had a target, certainly within a local government environment. Less so healthcare, there was something like 70% of local councils had declared an emergency, and they meant it. It was an emergency, clearly politically driven. And they were starting to establish their plans. Clearly COVID started to some extent, set those plans back, and they had to redesign, refresh, re-engage, I guess, in respect of their target, in terms of their net zero targets. I think the NHS and organisations wrapping the NHS have been the same, not been dissimilar. So 59% of people that we engaged with that responded to the survey said that they've got a target set and there's actions ongoing. But clearly nobody is delivering most actions, and that's work for us to do on all sorts of aspects of net zero. And then clearly right now we've got a crisis in energy called the energy crisis, and you know, every single day people like Martin Lewis describe how the future's a bit bleak, I guess, in respect of the energy price cap, and what can we do about that. And clearly from the people that responded to our questionnaire, carry on as normal. Is that an option? I suspect not. We can wait for government intervention, perhaps we can wait for some sort of crisis management, but carrying on as normal, which I guess 50% of those that responded to this survey suggested they are doing, perhaps isn't the right answer. So that just gives you a bit of a feel as to where people think at this point in time on social value, social, economic, or environmental. So social value in the public sector, from a Mitie perspective, we're doing a whole host of different things, and we'll come on to this when George explains a little bit about UCLH and when Gareth explains a little bit about our net zero initiatives. But there's something called the TOMS framework. So themes, outcomes, and measures is what TOMS stands for, and it's in linkage to something called the Social Value Portal, which to some extent is a local government initiative for delivering social value and measuring social value. Central government, including the NHS, describe a social value model. So similar but different in terms of its language. It has MACs, so MACs as opposed to TOMs, but not dissimilar, I guess, in terms of they are grouped into different kinds of initiatives on the three themes: social, environmental, and economic. We deliver social value as an organisation. We embed it in all that we do. We've got bid libraries going on, I guess, in terms of winning new work, and we take expertise and advocacy actually from industry experts in a number of different areas on social value. And of course there's that guide, the public procurement notice of June 2020, which allocated a minimum of 10% weighting to all public sector tenders. So as much as we are understandably a good organisation doing this stuff, we have to do it. It's to some extent mandated as well. 10% is a minimum, and I think that's important to remember. These are some of the statistics that Mitie has undertaken in 2022 so far, and hopefully you can read that from the back. But of our 13 social value targets, which included things like supply chain, community initiatives, sustainability initiatives, we're on track and some in delivering against our 13 objectives. And you can see on there, and I'll come on to it in a short while, things like ready-to-work programs, things like apprenticeships, and things like volunteering are clearly critical to our business and critical to, I guess, delivering services into the healthcare sector. Carbon savings is part and parcel of what we've got here as well. But things like employee engagement, and we all know the war on talent ultimately, and we're all to some extent fighting for expert, competent labour to obviously deliver the services that we do into hospitals. Engagement is quite important, of course, and I think there's a lady upstairs talking about, in fact it was the first lady upstairs talking about how she in engagement was to some extent mistreated by her employer while she was off sick. You didn't get paid properly, I think is what she said this morning, so that's not really an employee engagement point. Initiatives, the £40,000 saving here, which I'll come on to in a minute, is something called Bin the Bag. And again, upstairs we heard talking about sharps and the idea that sharps and removal of sharps in healthcare settings isn't now a bag, it's now a plastic box, and it's able to be reused. And something about Bin the Bag is, of course, the disposal of waste from a container that can be reused without needing bin bags is quite a lot of I guess saving monetarily and saving from a net zero perspective as well. We did a bit of work over the summer, and it was a lady called Charisse who was a summer intern with us, so a paid intern, in developing of the 43 initiatives that are on the screen here. These are the things that Mitie delivered today, and we thought we'd try and some extent subjective, but we thought we'd try and map them on an ease and impact graph. And you can see that quite a lot of the most used initiatives that we have within Mighty are in the high ease, low impact. I think that's an indication of where we are perhaps in delivering social value generally across different organisations. Not that we shouldn't be doing these things, by the way, and things like ready-to-work programmes or work placements are quite hard to achieve, quite hard to organise, and you might say have really high impact for those involved in them, but not necessarily high impact across the board in delivering social value with some quantity. But again, just a different type of perspective on thinking about social value and how simple things can perhaps be the easiest to implement and perhaps be higher impact. So things like the Mighty Star Awards, this is an internal recognition initiative within Mighty. It's got high impact, it really does, in terms of that staff retention, in terms of that staff engagement, in terms of those individuals that are no doubt under pressure, as you all are in your jobs. Getting that extra bit of goodwill out of individuals is massively important. And I think if anything's come out of COVID, the physical interaction, the team play is part and parcel of delivering to some extent social value, because you get more from more. And that's something that certainly I'm passionate about. I talked about the Mighty Foundation earlier, and this is a couple of slides on just our charity. So this is a charity, it's a not-for-profit organisation, and it has certain initiatives, particularly around employment, giving back and recruitment. And some of the employment statistics, as you saw earlier, around those apprenticeships, those paid interns, some of the recruitment initiatives are clearly employing and supporting, in social value terms, those that are disadvantaged, those that are perhaps disabled or unemployed or ex-offenders. And of course the giving back point is this point about a well-regarded workforce, a looked-after workforce will be more inclined to volunteer their own time, in working hours with the support from a company like Mighty. And the Ready to Work programme, and again, many of you might be more familiar with the Ready to Work programme than I am, but there are 4 areas of the Ready to Work programme. So clearly, work experience for anybody, ultimately. There's an Enable programme, which looks after or looks at employing people with disabilities. There's a military programme, so those that are ex-armed forces. And there's a Beyond Bars, so those are the ex-offenders that need support in getting back to the workplace, clearly give themselves and their families the best life chances. These are all examples I would describe of social value, as opposed to environmental or economic. Clearly, the point of employment links to economic value for those individual families and those individuals. So hopefully you can sense an array of things that Mighty do. This is our volunteering statistics. So we've got 14,650 hours registered. And again, data in, data out. There's only so much data you can capture. There's more hours than that. I'm absolutely convinced of it. And we need to do perhaps better at registering some of those hours on the basis that we know, as part of our organisation, we do support and allow people to be paid for donating their volunteering hours. And we've got high targets, and this is the point. One of the things that I think George will touch on, certainly in linkage to UCLH, is of course some of this stuff is not delivered just by us and just by our staff. It has to be delivered in partnership. It has to be delivered in collaboration with our customers. It has to be delivered to some extent in collaboration with the families of those people that we employ. But nevertheless, with statistics and data and incentives to some extent push this. This is the delivery of social value, amongst others. I'll pass on to Gareth. Gareth, as I said earlier, is our client development manager within our Plan Zero team, looking after all things energy. So we'll zoom into the environmental part of social value. Gareth, thank you.
Hi, yes. So as Hayden was saying, I sit within the energy Plan Zero part of Mighty. We're there delivering decarbonisation services. And in delivering decarbonisation services, we're frequently asked, what's the social value that comes with those? So the next few slides, I'm going to look at environmental social value. When we're delivering social value on energy and decarbonisation side of things, it's fair to say that it's split into two areas. I think there's the corporate targets, which companies can set, and delivering on those corporate targets by doing business with those companies, there's benefits to be had. And then you'll also see there's opportunities where we can build in certain types of social value by looking at contractual needs. So if we just move on. So what's Mitie doing? So Mitie, we've set some interesting targets, some far-reaching targets. We're committed to achieving, we've got two targets, net zero, UK Green Building Council net zero emission targets by 2025, so that's scope 1, scope 2. And looking at our overall whole operation, where we need to bring in scope 1, 2, and 3, we've got a target date there for 2035. How are we delivering that? As an organisation, we're signed up to a number of climate initiative groups. We're committed to science-based targets. We've got our science-based target actually being reviewed at this moment in time. If we move on very quickly, we've got, if we look at our estate, 9 of our offices are already decarbonised. But for us, fleet is a key component of our emissions, and if we look there, you can see we've got 2,568 fully electric cars and vans on the roads at the moment. That actually at the moment is the largest EV fleet in the country. It's changing very rapidly, and we won't maintain that status because we don't have the largest fleet. Our fleet size is 7,000 cars, so we're around about 40% there or thereabouts. But we're leading the way, and we see it's an important part of our corporate targets to reduce carbon. So what? Okay, if we just look at what does that mean? So we've got two graphs here. On the left-hand side here, we've got the carbon to revenue intensity. This is for Mitie since 2018-19. And on the right, we've got source of carbon emissions, and these are carbon emissions within NHS England. So if we're looking at the journey that Mitie's been on, in 2018-19, we had a revenue of 2 billion, and the carbon to revenue intensity was just over 14 tonnes of CO2 per £1 million of revenue. Run through to 21-22, and you can see that actually that has dropped significantly down to sort of around about 5 tonnes of CO2 per £1 million of revenue. That's been done at the same time that we've actually grown revenue. We've almost doubled revenue from 2 million to almost 4 million. So that's quite an interesting and challenging sort of statistic to get to. That means that we've totally decoupled revenue growth from carbon emission growth. And if we then consider what are the impacts of that, if we look onto the carbon, the source of carbon emissions in NHS England, the area where Mitie comes in is on the other supply chain. So 24% of what's defined as other supply chains is contributing to 24% of carbon emissions within the NHS. If we considered what that would be if all the suppliers in that category were doing the same piece of work as Mitie was doing, that would drop down to below 9%, about 8.76%. So there we've defined environmental social value just by the actual corporate targets that Mitie has in place and that Mitie is achieving. I guess achieving is the key point. So it's an important point to think. So if you set those targets and you achieve those targets, those are the businesses whereby just working with those, you will have environmental social value just by contracting with them. Moving on to the next area where we can deliver. So if you remember, I said there's the corporate standards, but then we can build in what are the opportunities if we just look at each contract level. So I'm in the Plan Zero team, and we're delivering end-to-end decarbonization solutions. So we consult, we design, we construct, we optimize. We've got that whole built-in sort of life cycle there that we operate within. And I think a lot of these, people will know Mitie. They know that we're in there providing energy reports. We're providing procurement, energy procurement. They know that we are delivering energy optimization and putting in smart buildings. BMS is talking to other initiatives in order to help the FM solutions. We're involved in decarbonisation projects, so putting in large-scale PV, whether it's PV on roof, or whether that is indeed something more remote. Some of the areas where perhaps we're not so well known is on consulting, so consulting on decarbonisation strategies. And then perhaps some very interesting ones start to come in, waste and biodiversity, and we're starting to think, well, what is this? This is an energy Plan Zero, but this is a holistic decarbonisation solution. And if you want to look at decarbonisation is scope 1, 2, and 3, and energy, gas, and electric only covers part of it, and we need to be looking at scope 3 as well. So waste and biodiversity, key elements there in a holistic decarbonisation solution. So let's just work on and then consider, well, what are the benefits of this? Sorry, this has been turned around from the way I did it, so it's just thrown me a bit. But, okay, when we're looking at contract level, we have the opportunity to build in the contractual value that the client wants, but then what's the social value? We can maneuver and tweak things in order to maximize social value that comes with contractual value. I want to put in the top one, even though it's not strictly speaking environmental social value, but training and employment pathway opportunities, because one of the things that we're particularly proud of in our team is that we've got this fantastic young lady who came, we employed her in a gap year when she was in her university, and we employed her on the university. We were doing estates management there. We then funded her through her last year when she went back to a full-time university course. And then after she graduated with a first, we then brought her on to the team, and then she started delivering Plan Zero decarbonisation initiatives on the university that she'd attended. It was a great example of bringing in that training and employment pathway opportunities. And there was significant value to the university because of how much she knew about the university. Let's just go down though and look at other opportunities. So I've already talked about published carbon intensity factors through corporate targets, but there are times when a contract might want to understand exactly what is the carbon footprint that Mitie is operating to as a supplier to them. And that means that they can know exactly what the carbon footprint is rather than just an average tons of CO2 per spend. And we did that last year. We did that with UCLH, which George is going to talk over UCLH a bit later. But it is an exemplar hospital which is keen to understand how it's delivering on its ESG commitments. So we can tailor and deliver actual carbon footprints for our operations. Just going down those, so decarbonised operations. So that's a pretty typical thing that we do. We'll have energy managers in there, and we'll have monitoring of various different elements of that. And if we're monitoring fixed assets and we know how they're operating from that data, we can start to move to things like predictive maintenance. rather than planned preventive maintenance. So there's actual additional value that just comes with that opportunity. If we're also monitoring which areas of an organization are in use, and let's face it, there's a lot of buildings where they're only getting partially used now, we can be flexible with cleaning, so that if an area has not been used one day, why do you need to send cleaners? These can have profound impacts, because if the cleaning's going on into the evenings and you turn in lights on and then you're using chemicals and you've got people in there, you can actually avoid using that by having that sort of monitoring ongoing. Behavioural engagement, Hayden's already mentioned recycling bin in the bag campaign, so moving on to landscape gardens. So landscape gardens is an area under sort of our biodiversity elements within Plan Zero that we're keen to sort of to show what we can do and how we can not only save carbon, but also how we can actually offset carbon through what we do in the landscape. And when we look at landscape gardens, and can't quite see it on this one, but we've got like a garden inside a hospital here. So it's an indoor landscape garden that brings well-being benefits. And there's now documented proof as to how healing gardens can actually improve the speed with which patients are recovering. So those are the sort of social values we can look to build in certain areas. Moving perhaps outdoors into landscaped areas, we have things like where we can consider trees. Trees placed in the right location can reduce cooling requirements in a building. They can also improve local air pollution, which can be key for well-being. So just to sort of recap, when we're delivering environmental social value, there's two opportunities here. There's the corporate and the targets that are set with it, and then we can delve down into where we can deliver actual additional social value by looking at what are the contractual needs. And that's it for environmental social value. I'll hand over to George.
Okay, good afternoon, everybody. I'm George Weeks. I'm the account director at UCLH. UCLH is a 39-year relationship, a partnership between Mitie and UCLH Hospital. We have a TFM service, so we deliver all of the facilities management services there. We have around 700 people delivering those services. And today I'm just going to talk you through some of the journey we've been on over the last few years to try to positively impact our carbon, our environmental impact, and our societal impact. So one of the first things we did, it was quite a simple idea really, but it was just creating a sustainability calendar. It sounds very simple, but it meant every quarter we was able to focus in on something we wanted to do either environmentally or socially, and then communicate that to our teams and our clients, and our and other stakeholders within the hospital, just to focus people's minds, set a target and a goal, and then capture how we're getting on. Really simple thing to do, but it got people thinking and talking about sustainability. Shortly after that, in 2021, we created a carbon roadmap. So this was a little bit more detailed and required us to undertake a fair bit of monitoring and involvement from Gareth's team. What it actually showed us was we was already at our 2025 target in terms of carbon reduction. So we'd already reduced the carbon in the hospital by over 80%. There's a number of ways we did it, which I'll come on to, but it was able to enable us to focus on where we got to, and then realise it's not just about getting to 80%, it's getting to net zero. That's going to be, it's a lot harder. That final 20% is going to be a lot harder to achieve, but it enabled us to really focus the minds on where we've got to, celebrate our achievements, and then look to see what else we're going to need to do. And one of the sort of practical things we've been doing is getting better management information. So we've installed over 150 sub-meters now in the hospital. This gives us that precise information about which part of our hospital is using more energy. Where do we need to have a look to see if it's abnormal energy usage? Is there a bit of kit that's working when we don't need it to be working? So this has really helped us get a far better understanding of our building to pinpoint where we can make our savings. We've also implemented all of the proven technologies that you would imagine. So We've installed over £5 million worth of LED lighting, so we've retrofit the LED throughout the hospital. We're installing right now solar panels on the roof. There's things like air source heat pumps that we've investigated, and I'll come back to that. It wasn't quite as, we haven't quite got to the point of installation with those. And things like air handling units. So as kit's coming to the end of its life, air handling units, usually about 20-year lifespan. We're about 20 years old as a hospital. We look, instead of just going for like replacements, it was looking at what is the energy saving, is there efficiencies, is there resilience? So the air source heat pump, so the air handling units that we've now installed, not only are they more efficient, but they're actually more resilient than what we had before. And also on the social side, so over 117 days of volunteering completed last year. Obviously, that's a direct sort of benefit for the people, the charities that received that volunteering, but it's also for our staff. The well-being of our staff, significantly improved through being able to give back to society, to the charities. And equally, we've developed 14 apprentices on the account at the moment. So that's from technical teams to for security teams. So it's a range of apprenticeships. We're not quite where we want to be yet. We want to get to 5%, which is doubling again. We have doubled each year for the last 2 years, and the plan is to keep going with that. And throughout all of this, it's about communicating, because the only way we're going to get everybody to buy into what we're doing is to constantly remind them of what opportunities there are and how we're doing. So the case studies here are just some examples. We did over 90 case studies last year. Just simple 1 page, 2 pages documents that just say, what have we done? What have we done? So here's some examples of installing the sub-meters, some of the charity stuff that we've done, the volunteering, the LED lights. We just like to remind our stakeholders of what we've been doing and how we've been getting on. So between UCLH and Mighty, these are the 5 targets that we're focused on. So the first is around carbon. So as I said earlier, we've actually achieved our carbon objective 4 years early. The second is around trying to phase out fossil fuels. This has been more tricky, so this is a really difficult one. We have engaged and done a feasibility study on air source heat pumps. But being where we are, so we're in central London, we're just by Euston Road and Tottenham Court Road, we're very, very limited on space. And to get the size of pump we need to take off our heating off of fossil fuels, off our boilers, our gas boilers, and onto an air source heat pump, we just haven't got the footprint. So the technology isn't quite there yet for us at this current point. But we are still looking and we're still trying. Recycling, so this one has been one where we made some really good progress early on. So in the first couple of years we made really good progress. We went up to 50% recycling rate. But during COVID and now with living with COVID, this has really taken a backward step. This has been a real challenge to get the recycling rates back up. I'll come back to that one in a moment. The removal of single-use plastics is another one, and I'll come back to that. And water. So how we got on? Paper. So reduction in the use of paper has been a really successful one for us. So we've taken 85% of the paper out of the system than what we used to have. We've done that through installation of PDAs. So our engineering staff now use PDAs. Our catering staff now use PDAs rather than reams and reams of paper. And a number of sort of behavioural programs as well with that. We've removed all of our single-use plastic from our catering team, so that's 340,000 pieces of plastic from our catering team. Novalu have been engaged with to try to reduce our water consumption. Again, this is one where we're having less of a positive, less impact at the moment. Water usage has gone up during COVID. Hand washing's increased. It has been a real challenge to try to make a positive impact on that one, but we're engaging with specialists to try to see what could be done. I talked about the air source heat pump challenge, and whilst space-wise is a real challenge for us, we've looked at other ideas. So being where we are in London, there's a sewage recovery or heat recovery system that we're trying to look into, district heating schemes. The challenge being that we're a 22-storey tower in central London, and getting that heating on a regular and consistent basis is a real challenge. And then I said about recycling. So yes, we are we're not quite back to our pre-COVID numbers, but this is one where we had to get into the detail. You have to understand what has changed during COVID. What is now being delivered with extra packaging, and I would say we're just about getting back to recovering where we got to pre-COVID. The use of recycling of masks is a real benefit. We can actually start recycling single-use masks, and there are providers that can support with that. That's definitely helped, but there's still a lot more to be done. To get to 80%, we're going to need dramatic change really in the way we manage our waste. A program that we've engaged with the NUS with. So this is the student union is Green Impact. So Green Impact is an initiative where they will assess green projects. So we've worked with them. So we ourselves have had 5 gold awards, but we also engage with clinical teams to do projects, and they will be judged by the NUS program. That's a really good behavioural program change, because the only way we're really going to make big impacts now with recycling and some of the energy usage and get that last 20% of carbon out is behaviour. We need people, everyone in the hospital, all the partners in the hospital, clinical teams, estates teams, all to buy into this. And those behavioural programs are really useful for that. And we've had a bit of recognition for what we've done. So we made good progress in the last 2-3 years on our sustainability journey. There's still a long way to go, and the last bit is going to be even tougher, and it's going to need real partnership working to get there.
Great, thank you, George. So you've heard there, I guess, some examples and passion and enthusiasm by our 2 colleagues over there about the kind of things that they're doing on site or across the company. And hopefully, these are my takeaways, and there might be a 4th one actually about continuity and I guess resilience in doing some of this stuff. And the first one is, clearly we've all got a part to play in social value, individually and on behalf of the organisations that we work for or that we help. And I think that starts the ball rolling in terms of what I've said about a potential 4th one, the continuity point, the continuous improvement on what we do. There are some easy options. There are some easy options that we can take individually in developing social value for ourselves, our families, as well as our workplaces. And there are others that take more effort. Clearly they take capital investment potentially to get some of these things alive. And they take plans, business cases that need to be well written in order to get through all sorts of different governance scenarios. But each have varying impacts. So it's not to say that some of the easy ones are low impact. Some of the easy ones can have high impact. Some of the harder ones actually might be low impact in terms of multiples. And number 3 is, and George just picked up on it then, is this point of partnership, collaboration, taking in expertise from third parties. To reach many of the targets that we set ourselves, we have to collaborate, we have to work together. The power of partnership, I think, was the phrase used upstairs by Emma. So hopefully, out of the last 30 minutes or so, you've taken a few ideas, a few thoughts, by way of example of what we are doing in collaboration with our customers and what we are to some extent proving for ourselves we can do for ourselves.